In this video, I'm going to talk about the best executive dysfunction treatments that you can use that have helped me with my ADHD and also for my patients that have ADHD. One of the biggest challenges of growing up with ADHD, I had executive functioning issues and really didn't know about this until I was in college. But when I went and sought out after a counselor to help me kind of identify these issues, it made all the difference as far as when it came to helping with my executive dysfunction for treatment. And I want to help you understand what are the best types of treatments that you can implement so you're not having this issue. So let's go right into that. So first off, I'm going to talk about 3 different treatment and strategies to help with your executive dysfunction issues. More specifically, if you have ADHD, because most people with ADHD have executive dysfunction. So the very first thing that you should do is seek out hiring someone that can help you identify the executive dysfunction issues that you do have. So this be looking for a counselor like I did, looking for an occupational therapist, looking for a behavioral therapist, someone that can kind of do cognitive behavioral therapy, or someone that specializes in ADHD or executive dysfunction, because one, what they're going to do is be able to help you identify your weaknesses and your strengths when it comes to executive function. And why that's important is that 2, it'll help you understand that really focusing on your strengths will help improve your executive functioning issues. And third, why it's so important to hire someone to help you with the executive dysfunction is that they can hold you accountable to follow through with the strategies that they're going to implement, the treatments that they're going to give you. So that is so critical. The second treatment and strategy option for executive dysfunction is that you first, this should have been the first, but the first thing that you should be doing is seeing what are imbalances in your body chemistry and your brain chemistry. Because if your brain chemistry and body chemistry are out of balance, it's going to make it really difficult to implement executive functioning skills and strategies because things are messed up here. So what you need to do is first run some testing. Find a doctor that's going to run really in-depth testing. I'm talking about looking at vitamin deficiencies, looking at your neurotransmitters, your brain chemistry, dopamine, serotonin, norepinephrine, epinephrine, running all those different types of neurotransmitters. It's going to make a huge difference to know what types of treatment, because that will help you understand what types of supplements to implement, what types of medications to implement if you're going to go that route. To be able to understand that will make all the difference if they'll be able to help with your executive dysfunction issue. Second is you need to find a doctor that is going to customize, when they run that testing, they're going to customize it to your needs. What foods to implement, what foods to avoid, what types of vitamins and minerals to implement, what is going to be the right kind of medications. And then third, you need to make a decision whether you're going to do a combination of medications as well as non-medication treatments, or if you're going to decide if you're going to do it without medications and go more the natural solution route. In order for natural solutions to work for your ADHD and executive dysfunction, you have to have it customized. You got to run testing like I mentioned before. The third treatment and strategy option for your executive dysfunction is that you need to be creative and try to make these executive functioning skills and strategies part of your own. So let me give you an example. So sometimes you'll find different executive functioning strategies and skills to implement, such as like time management and planning, but you'll learn about it and you'll realize it's not working for you. Instead of just putting it to the side, saying, okay, that doesn't work for me, learn how in your own environment, how you can make that your own. So another example is like first understanding if you are a visual learner or if you're a hands-on learner, if you're an auditory learner, understanding what your strengths are. This goes back to the first one, understanding your strengths so that you can implement these executive functioning skills to make them your own. You got to be creative. That's what I had to do to implement these to make them work. Otherwise, it won't. So another example of this is going back to understanding what type of learner you are. So let's just talk about time management, for example. If you're struggling with time management and planning and doing tasks, if you're a visual learner, what you should be doing is having a big visual board in front of you where you see it all the time in your room, in your office. I love whiteboards, so that's what I do. I'm a big visual learner, so I use whiteboards and have different colors, different magnets, different, colors and stickers. That's because I'm a visual learner. And by doing that, it really is engaging. I'm actively doing things, so therefore it's solidified. I remember when I'm actually writing things down, doing colors, highlighting stuff, but that's me as a visual learner. It's also part of being a hands-on learner because you're actively doing stuff. But if you're an auditory learner, maybe you need, an alarm clock, but maybe that actually voices the task, like,
remember to take out the trash.
I mean, if it's robotic, but at least if you're an auditory learner, and it reminds you, then that makes that connection. Okay, so you just got to understand what are your strengths, how can you implement that and make it your own and be creative versus just watching something and learning what worked for one person might not work for you, but you don't need to put it to the side saying, oh, that doesn't work. You just need to make it part of you. Creative. What kind of strengths do you have? How can you implement that and make it be part of you? These 3 treatment and strategy options for executive dysfunction is absolutely necessary. It is so necessary that is exactly what I did to get myself through college and medical school, and I did it all without using medications. You heard me right. I did it all without using medications because I implemented these 3 things. Now you might be wondering, okay, how do I do this without medications or with medications? How can I make my ADHD and executive functioning skills more better so I can have more of an optimal mind? Well, join me on this training right here where I go in more depth as far as what to do specifically that I help my patients and my clients help with the executive functioning issues that they're dealing with, help them with their ADHD so they can have a more focused mind. This free training right here is the focused mindset formula to help you understand this. So join me right here and I'll see you guys in the free training.